okay? I'll give those to you afterwards, okay? I got you a pad and a pen in here, so
you're live.
Okay, all right. So welcome, Facebook friends. First of all, thanks for joining us tonight. And for the rest of you guys, welcome. All right, we're going to get into the brain without much ado. We're going to get right to it. After we kind of go through everything, we'll release our Facebook friends, and I'll be able to answer some questions for you. And as always, I'm going to have a special offer, some for everybody, including you that are watching on Facebook. And then there's going to be some special things just for y'all. We also have some special gifts in a couple of the bags. In addition, everybody's going to get some things in the bags, but there's going to be a couple where they got a little extra special stuff. So maybe you get the lucky bag. I don't know. So if you don't know who I am, most of you do, so it won't take long. Dr. Lewis Clark. I've been 27 plus years as a chiropractor. I'm also board certified in integrative medicine and a certified wellness practitioner. So those things kind of give you a little bit of my background. And one of the things that we obviously deal with a lot in our practice is brain-based problems. And we're going to be talking about the brain today. So let's get started. I will say this, that out of everything that people, I guess, fear or certainly think about is the health of their brain. And so that's why we want to really spend some time today to see a few things. Number one, where are we as far as how's our brain doing? Number two, what kind of factors are involved that may be making us or putting us at risk? And then lastly, of course, I'm going to give you some really good things that you can begin to do. All right, and that's the good news. So just from being here, you're going to pick up some amazing things, okay? All right, Laura Marie, one thing. Oh, never mind. You already got everything that I need. So let's get going. Overcoming brain-based issues. So we talked about where are we. I'm going to give you clinically what we look at as a practitioner is that which one of these categories are you in? And so I'm going to give you some key indicators so you kind of just get a little bit of an insight of where you might be. Transient neuroinflammation means that your symptoms come and go. And that you have good days, and then you have days that are not so good. And the most common brain-based symptom that goes with this transient neuroinflammation is brain fog. And so how do you define brain fog? Well, that's a slow brain, number one. And it means like, I can't remember why I came into the room or where did I put my keys or that kind of stuff is very common with brain fog. And of course, neuroinflammation means brain inflammation here in what we're talking about, okay? And so then there's chronic neuroinflammation. So instead of coming and going, now it's become chronic. And so when it becomes chronic, you don't have too many good days, okay? You know what I'm saying? In the love you, occasionally you do, and you're like, wow, that was good. How can I repeat it? And you really can't. So you're having more of those, and in this you start getting more emotional effects. It begins to affect emotions where you may be impulsive or you may even be a little bit depressed in this and may have bouts of that in this stage, okay? And then once you get to this stage here, this is where your cells in your brain, microglia, are primed. And what that means is this. 90% of the cells in your brain are not neurons. Now, your neuron is a brain cell. So you say, hey, I thought all of these were, we just need to be careful we don't get in front of the camera, okay?
Oh, yeah.
Yeah, so you thought your brain, all the cells were neurons, but they're not. It's actually 10%. So what are all these other guys doing? Well, they're glial cells or immune cells, and they have other purposes, okay? And they're basically taking care of your brain, helping your brain. They're protecting it. They're pruning it or kind of cleaning it up, making it more efficient. They're doing a lot of things like that. But when they get to this point, that means that the microglia now are primed, and they're only doing one thing, and that's attack. And we'll talk about how this happens and stuff like this. But in this stage, now you have what's called sickness behavior syndrome, and it means basically, you don't have very good days. Depression is the most common thing with this association. And then the last and worst, most severe category is neuroautoimmunity. What does that mean? What does autoimmunity mean?
Attacking yourself.
Your immune system is attacking yourself. And in neuro means it's attacking attacking your nervous system, in particular neurons and brain. Okay, so that's a really bad thing for us, right? So we'll kind of go through some of these things, but here's the thing. We talked about those glial cells. Whenever they get primed, this is an example. This is an egg, okay? But I'm just going to use this as an example. Once they get primed, they can never go back over here. You understand? So we all have some of this, and that's okay. But when it becomes too much in one area of the brain or globally, that's a big problem. Okay, so, and if it happens early on, it's a really big problem when the brain especially is still developing. And we'll talk about some of these cases and how those happen, because that's basically your autism spectrum disorders. Okay, that's what's happening with that. All right, you got a massively inflamed brain. All right, so there's also obviously subtle or mild to severe. This goes through a little bit of what we talked about here. So not only do you have the progression we just went through, but you also have, is it in those categories? Is it subtle, or is it moved to moderate, or is it in severe? So the brain fog, again, we already talked about hazy speed, slow speed, hazy thoughts, slow speed, reduced endurance. What does that mean? You have mental fatigue. So you try to read a book, and before you know it, you can't stay awake. Okay, you're on the computer too long. Maybe you're trying to drive, and it's a little bit tense, and all of a sudden you're just exhausted. You know what I'm saying? Anything where you have to engage the brain for any period of time, you can't do it. And so, how do we know these kind of things? In an exam, what we do is we kind of stress your brain to see how your endurance looks. And plus, we ask a lot of questions in the history and things to find out if this is going on. So in other words, like some people, let's say I do a test like finger to nose, which is a cerebellar test particularly. Okay, so I do it once or twice, and they look pretty good. I'm doing this with their eyes closed. I've got them in Rombergs with their feet together, and their first couple passes, they're pretty good, and they're right on the nose. And then all of a sudden, we go to the third or fourth pass, and they're over here. Well, guess what? They have fatigue. They have endurance problems. Their brain fatigue just with a little bit of stress, a little bit of activity. Okay, that starts to happen. Okay, then you get more and more of the emotional and more symptoms. We get depression. We get more tiredness or fatigue. Here's a big one: loss of motivation and even loss of appetite. That's huge. And then the last one is the most common symptom or condition is dementia. All right, but there can be seizures. There can be difficulty speaking. You can get some of that in this phase also. If you get tired, you have a hard time with your words, either finding them or making them. You may have a hard time interpreting that, depending on which part of the brain is affected. Let's give you some ideas of things to look for, okay? So tonight we're going to talk about this right here, blood-brain barrier. All right, so you have different barriers in your body. Give me another example of a barrier besides the blood-brain barrier. Skin, that's excellent, okay? What else?
Veins.
No, not so much, because they kind of go through all these barriers. I'm talking about like gut, yeah, lung. These are other places where things come into your body, but you don't want everything going into the bloodstream, right? So what is a barrier? A barrier is like a screen on a door. So you got or a window. Let's say you've got a window in your house with a screen on it. You open up the window to let air in, but you got the screen to keep mosquitoes out, right? Okay, so that's what a barrier does. It lets some things pass. They're small enough, but it doesn't let the other bigger things pass that are not supposed to be there, right? When we get a blood barrier breach, especially when we get a blood-brain barrier breach, now we're letting things into the brain that are not supposed to be there, all right? And now we'll talk about why this happens, and there are times when it happens intelligently, and there's a reason for it, but it must close back, okay? In particular with traumatic brain injury. So you get some type of head injury, okay, and you've got damaged tissue, you got damage to cells in your brain. You need you're going to have intelligently, your body is created and designed by God, I believe, intelligently. And so it's going to open up, and the reason it's going to do that is to allow T cells to get into your brain to clean up the mess. But then after that, if everything's working normally, it's going to close back. And the problem is if it doesn't. And we'll talk about that, all right? But that's a big problem. So blood-brain barrier, there you can have neuroinflammation with an intact blood-brain barrier, and I'll go through a few of those things and how that happens. But a lot of times, if it's going on long enough, you're going to end up with a blood-brain barrier breach, and then that's a lot bigger deal, because now things are getting into the brain that are not supposed to be there. So this is an example of how you can have a neuroinflammation without or with an intact blood-brain barrier, at least initially. And these are the ways that it happens: traumatic injuries and vascular injury. What's a vascular injury? Stroke. Yeah, it's a stroke. That's what it is. Okay. And so when you have a stroke, man, you got damaged tissue, right? When you get a traumatic brain injury, you also have damaged tissue, all right? And I saw a couple of these in my office yesterday, as a matter of fact. Two very severe cases. One was ex-military and a lot of explosions and trauma. And one was had benign tumors in the brain and had 2 brain surgeries. So surgery is very traumatic. And then on top of that, had some chemotherapy and about 3 rounds of radiation. So there's a lot of trauma. But I can promise you both of those cases have a breached blood-brain barrier, because ultimately when these chemokines are released, these are chemical messengers inside the brain. Then it begins to activate these type of glial cells right here called astrocytes, and they kind of wrap around and protect that blood-brain barrier. But when they get activated, they just turn loose. You see? And again, it's intelligent for it to do that initially. But if it doesn't stop, if this inflammation doesn't stop, that's a huge, huge problem. And then we get this priming of microglial cells. What this means is that your friend?
Yeah.
Wonderful. So with primed glial cells, what that means is, remember how we saw that egg? First, when the glial cells are doing normally, they have little arms and little tentacles that stick out, and they use these to move around in your brain, which is kind of freaky, right, when you think about it, okay? But there's little microscopic cells moving around your brain, and guess what they're doing? They're cleaning up. They say, hey, we've got a protein tangle here, which every neurodegenerative condition is related to some type of protein problem in the brain, like dementia, like Parkinson's, like Alzheimer's, okay? And so what do these things do? They say, hey, the neurons are tangled up here. We got some protein tangles. Let's break them up. That's what it does. It repairs that area, frees it up. So they need those little tentacles on there to move around. And sometimes they'll come along for things that aren't supposed to be there. They'll attack them and get them out. But once it gets primed, it loses its tentacles, and now it doesn't move around, it can't move around, and it can't do any of those other things as far as cleaning up the brain. It only attacks. And again, like we said, it attacks tissue. Okay. So we don't want to get here very much. We'll look at factors that involve that. All right, so neuroinflammation, this is the second mechanism. Now you've got a blood-brain barrier breach from the beginning because of some of these things. What kind of things put a stress on your blood-brain barrier? Well, anytime you see antioxidant depletion, what's your number one antioxidant in your body?
Oxygen.
No, that's a good one, but it's not the number one inside the body. Glutathione. How many people heard of glutathione before, okay? Glutathione depletion. When your glutathione levels get depleted, you're going to have problems. You're going to have a tough time dealing with free radicals inside your body. Infections, of course, are a big deal. Chronic stress. I mean, if you're under a tremendous load of stress over a long period of time, it can even cause a blood-brain barrier breach. Now, what does a breach mean? Remember how we talked about that screen? What a breach means is that you got a little cut or a hole in your screen. Now it's letting mosquitoes in, right? So that's not a good thing. And then we've got other things that, like from the gut, we got zonulin levels elevated, and of course chemicals are a big deal, all right? So then we get the activation again, you get the primed glial cells, and if you already have some things going on, this is called the second hit. So let's say that a year ago you were involved in a car accident and you hit your head on the steering wheel side of the car or whatever, okay? And so you had some neuroinflammation from that, and so you've already got some primed glial cells already going on inside your body, and then you have a bad fall and hit your head again. Or you end up just all of a sudden you get a change at work and you got a tremendous amount of stress on you, or something happens in your family, or your for whatever reason, you get an infection. Then guess what? The second hit's a lot worse because you already had problems. This is where the sickness behavior syndrome comes in, and depression and things like that hit. So, you know, I know some of you already, I can see you're starting to go back in history and going, oh yeah, I did the same thing, by the way. And I'm like, thank God I survived those. I remember 3 years in my life when I was in my 20s, and I was, this is around 89 to 92. Okay, so about 3 years there. Man, I had a lot that happened to me, and I didn't really realize this till I started studying this stuff and thinking about my own brain. And I was like, anytime you're knocked out, by the way, you got prime microglial cells. Okay, so there was a time where I fell, hit my head on the concrete, and I was knocked out. Didn't wake up till I was at the hospital. So the ambulance came, everything else. I was out for a long time. That's a bad injury. Okay. Then I had a major car accident where I was hit and T-boned in the side and totaled my truck. And while all that was going on, also I started chiropractic college. Okay, my diet was terrible. I was abusing things I shouldn't have, and that's a miracle in itself. And then once I started practice in 1992, I had a four-wheeler accident where a compound fractured my leg, but I also hit my head really, really hard. Okay, so you can overcome these things, but thank God I knew how I was getting adjusted. I was doing some of the things I want to show y'all to do, and that's what made the difference, okay? Because we all got some of this stuff that's happening. But if we got other underlying factors, it takes a much bigger toll on us. And lastly, again, this is where we got peripheral inflammation, but an intact blood-brain barrier. But these are things like your vagal nerve is not working, your gut or your liver, or some type of other autoimmune process going on inside the body. Okay, so these things can happen even with the blood-brain barrier intact. You know, your liver and your gut both. But I've always said this. I mean, if you've watched any of my brain seminars before, you've probably heard me say this: the gut on fire, brain on fire. Inflammation here, inflammation here. By the way, it goes the other way. You end up with a head trauma, inflammation here, you're going to end up with an inflamed gut too. It goes both ways. Communication between cytokines and other things affect each other. So, here's some of the most common reasons of microglial priming. And again, it's the traumatic brain injury is number one in older and younger adults. Look at this one here, autoimmunity in younger adults. By the way, autoimmunity is the illness and the condition of our generation in America. Okay, I mean that's the thing that we're going to have problems with.
So is that any autoimmune disease?
Yeah.
So like diabetes or whatever.
If diabetes could be it, absolutely. Any of these things are going to set you up for microglial priming, because for a number of reasons. Number one, you've got immune cell activity, okay? And anytime there's immune cell activity and there's tissue damage, there's systemic inflammation. So basically, inflammation is an intelligent response of the body to tissue damage. The problem is if it's going on all the time, guess what that means? You've got damage all the time. And there's other factors that get involved. It's not meant to be going all the time. It's meant to, hey, you had an injury, let's get the cells over there that we need to make it better and heal it, and then let's get back to a normal life. But when we don't do that, that's when it becomes a problem. So yeah, any autoimmunity could be affected by that. Did you have a question?
Yes, is seizures included in that?
Seizures could be, because seizures are not necessarily autoimmunity. A lot of things could cause that. But anytime you got seizures, you know you're on down the road as far as neuroinflammation. So there's a lot of neuroinflammation going on for whatever reason. In older adults, you've got age. Okay, so because if these things add up, I mean, you know, hey, I'm in my 50s right now. You don't see how I'm doing in my 70s after all these things that have happened to me, right? So sometimes this age and it adds up. We haven't taken really maybe as good a care of ourselves as we should have. In younger adults, infections are a huge deal. And then silent stroke in people over 60. A lot of people over 60, but a lot of people I see, period, have poor circulation. They have poor oxygenation. They're either anemic, they're so sympathetic that they don't get good blood flow, or they've got poor cardiovascular health. Okay, so a lot of different reasons for it, but those are your most common things to watch out for. All right, now variables that affect it. So how much impact is that hitting your head going to have on you? okay? So one person, because of their overall physical condition of their brain and their body, they bump their head getting out of the car and they're laid out for 2 or 3 days. The other person, can take a pretty good hit and they're not really affected by it, right? Why is that? Well, these are underlying factors over here. You got diabetes. Diabetes is huge. That's a major effect for inflammation on your brain. Smoker, again, circulation's poor. Antioxidants, your glutathione levels probably been depleted like crazy. Inflammatory bowel condition. Guess what? Gut on fire, brain on fire, right? So we don't want to forget that. A diet being inflammatory, anemic. We talked about. Previous brain trauma. Remember, there's already some issues going on, then you have the second hit. And that's a big deal. Okay, vascular inflammation. This would be something like possibly elevated C-reactive protein. That's where another place where the autoimmunities in other places, because they elevate inflammation markers, C-reactive protein in itself is damaging to the blood-brain barrier. So if C-reactive protein is something made in the liver in response to inflammation.
What did you call that?
C-reactive protein, CRP. And then antioxidant reserves. What do we think when we say antioxidant? What do we mean? Glutathione. Okay, always remember that. And those other ones, vitamin C, vitamin E, vitamin A, these things are good, but your number one is glutathione. All right, so let's get into something here. I want to leave plenty of time at the end for questions, okay? But so what kind of intervention are we going to make? Okay, I'm going to show you some things here in a minute that kind of cover the gamut, but I'm going to start with diet. Number one, first of all, non-negotiable is you got to be on an anti-inflammatory diet. Okay, so what kind of foods are inflammatory? An anti-inflammatory diet means that you're not eating inflammatory foods. Okay, so what are inflammatory foods? They're up there in case you're wondering, okay? The big three are
Fried food, dairy.
okay, now that's up here. I'm going to come back to that. But look at this. These are your foods right here. Gluten, dairy, and sugar. Those are your 3 most inflammatory foods, with the exception of these bad oils. Bad oils, yes.
Now, when you say dairy, like, are we even included like aged cheese, like
Could be.
cheddar, or is it like mainly just like the milks and
Okay.
the creams and stuff?
Great question. Let me talk about dairy for a second, okay? So with any kind of inflammatory food or immune stimulating food, proteins are the problem as a general rule. Now, sometimes carbohydrates can be like in lactose problems and stuff like that, but as a general rule, proteins are the problem. So any like a butter or a ghee, especially because ghee has no protein in it at all. Butter has very little protein. Cheese is going to have less protein. So some people can tolerate that. It's less inflammatory. But when you get into milk, oh my goodness, it's got sugar and a lot of protein in it. And then you get really inflammatory food. So it depends on the person. The answer is, but until you know, you got to get rid of it, and then you got to bring it back and make sure that symptoms don't reoccur. So the goal is that, look, if we're having anything, we want to improve our brain function, we want to improve our overall health, that we get off the inflammatory foods, get to feeling better, and then add the inflammatory foods back one at a time to make sure you tolerate them without any reoccurrence of symptoms. And if you do, guess what? You can have it for a while, at least 6 months. Let your brain heal and then see, or your body, or whatever it is. And it gets more severe depending on it, okay? So let's say that you got autoimmunity. So now you're probably going to have to go maybe grain-free. Maybe you've got a joint autoimmunity. Joints autoimmunities are affected by lectins, which are in like legumes and nuts and nightshades. Okay, so again, this is all where you need some help. This is where you need somebody to help you figure out where you're at. But these are essentials. You got to get off the bad fats and get some good fats in, which I'm going to get to in the next slide. Okay, and then make sure you're stabilizing your blood sugar. That's big. And now, as your condition, let's say if you're in those more severe levels, okay, like somebody mentioned seizures, got to be over here, ketogenic, but it means modified ketogenic because it's gluten and dairy free, okay? So ketogenic, okay? This is the way to go. Man, I had a patient that I worked with last year, that saw me. I was our 13th or 14th doctor. I can't remember how many neurologists she'd been to, and she was having these seizures, these myotonic seizures, which basically means that your body jerks, okay, which is horrible. And we were able to reverse that condition with her by doing some chiropractic, brain-based therapy, and a ketogenic diet. So thank God for that. But this would be for somebody again that we know has got really a big amount of, and that they might start over here, and it may be a while before they can get to this. And then if you get into this, how many people did ketogenic diet before? Okay, I figured there's always a room. You get 2 or 3 people together, somebody's tried it at least. Okay, and did you get into ketosis? Were you able to get into ketosis? Okay, some people can, some people can't actually. So some people can't do ketogenic diet. Now a lot of people can never start there, especially if they got brain problems. But they get better, they can do it. Okay, and it really will help them if they can. But when you get into ketogenesis, here's the thing: for maybe you do really good for about 6 weeks. And then all of a sudden you kind of hit what they call adaptation or keto adapt. And so now all of a sudden you're checking your urine and you're not seeing ketones in there. So what happened? Well, you need to shock the body a little bit because your body's adapted. And this is where you can add in some intermittent fasting after you get to that point, okay? And that means basically, hey, you eat dinner and you don't eat again until the next lunch, possibly. You skip usually a breakfast is what you do, okay? It's all just a little bit more advanced than what we're going to get into today. And then realize this right here. This is something I have to get grasp on here as a clinician, okay, treating with people. If you got transient neuroinflammation and you're working with the right person, you're probably going to have a pretty smooth trip to recover. If you get chronic neuroinflammation, it's going to be a little steeper and harder to climb. It's probably going to take longer. But if you get to prime glial cells or autoimmunity, yeah, it's going to be up and down and all over, and it's going to be a tough struggle. And you know what? Honestly, you're probably still going to have to manage this for the rest of your life. But you definitely can do better no matter what stage that you're in, and with the right. And so your friends and family members that you're thinking about, okay? There's ways to improve. But just realize not everybody is going to be able to make a 100% wonderful recovery. It's all about better quality of life is what it's always about, okay? And longevity. Right? I mean, how many people are interested in keeping their brain for the rest of their life, right? I'm like, yeah, I like to keep what I've got as long as I possibly can until the end. All right, lifestyle neuroinflammation. Now, what affects neuroinflammation and lifestyle? If you've got an inflamed brain condition, alcohol is not a good thing for you, okay? Especially if it's cerebellum. Cerebellum controls what? ABCs. Accuracy, balance, coordination. Okay? So, why you ever wonder why they do the drunk test? Okay, why do they do that? Well, checking their balance, checking their accuracy and their coordination, and their eye movements too. Eye movements controlled by cerebellum, but that's also part of coordination, okay, and accuracy. So that's why they're checking those things out. Alcohol is a bad thing for a neuroinflamed case. Exercise, a really good thing in the right amounts and the right type. What's not good? Long endurance. You see, long times of working out and you don't have enough brain endurance to do it. So you can really set yourself back. What is really good is burst training, high intensity training where you have short periods of time of really intense, and then you're done. You know, and then walking and moving and stretching and things in between. So you're always getting some good movement. This is where chiropractic adjustments are really powerful in decreasing neuroinflammation because they bombard the brain with good input to reconnect the brain to the body and to get the brain firing like it's supposed to again. Stress, what do you think? Not good, right? Okay. Diet, we just went over that. We know how important that is. What about this one?
Important.
It's real important.
If I'm working with a neuroinflamed patient, my number one priority is make sure I try to improve their sleep. That's the first thing. So, hey, we gotta try to improve your sleep. If you don't sleep well, you can't heal well.
Mm-hmm.
Sleep's critical. Okay, so we gotta work with that. Okay, and start making it better. All right, so we kind of went over that. Okay, let's move on. All right, nutraceutical. What is nutraceuticals? That's nutrition. That's supplementation. Okay, what kind of things really make a big difference? Well, I'm going to tell you. Y'all familiar with polyphenols? Okay, These are things found in plants. There's over 500 of them. I'm going to show you the ones that have the most research to support them. And by far, the most research has been done on this one right here, resveratrol. And what form should resveratrol be in? Liposomal. Y'all know what that means? Like, what the world does that mean? Lipo. Whenever you see lipo, that means fat. Okay, so what this means is that this resveratrol molecule has been attached to a fat molecule. And why is that important? Because your cells have a membrane around them that's made of fats. So if it's already fat soluble, what can it do? Get right into the cell. Instead of having to be converted and changed and made where it can go in, it can just get in. And by the way, resveratrol and these things here can cross the blood-brain barrier, okay? There's a couple more that aren't on here. These two we use in our office all the time, okay? And by the way, not all of them work exactly the same for each person. Because guess why? There's something else that's necessary to activate these polyphenols. And it's called probiotics. Healthy bacteria in your gut. Because, and by the way, what type of probiotics you have will determine which one of these will be most effective for you. And the better diversity you have, the better you're getting phenols into the brain where they can decrease inflammation. Green tea is another good one. Parsley and celery have a lot of polyphenols. Coffee has a lot of polyphenols. So then we have essential fatty acids, in particular DHA. DHA, these are two things found in fish oil. Those are two types of fats found in fish oil. DHA is found 20 to 1 more prevalent in the brain than EPA. And DHA is for building things too, okay? So if you're taking, you've got to know what kind of supplement, fish oil supplement you're taking, what are the levels here, is it a pure good supplement? Those are all important things. Short chain fatty acids, these are what's called postbiotics. These are like some of the work of the probiotic, and they also feed the probiotic. So it's kind of like a pre and a post. But these are butyrate, acetate, propionate. These are type of things that are made in the gut, involved with your probiotics. They have a huge impact on decreasing inflammation.
So you don't have any way to take them other than just taking your...
Yeah, you can take these. We have this in a supplement. It's called Enterovite that we use all the time. It's one of the things that matter of fact, out of all this list, that and these two, well, I'll say these three really, but we use all of them. But it's one of the things we use a lot. Magnesium is also important. So we had a patient a few weeks. We've been working with him for about a month now, maybe a little bit more. He's about 6, 7 maybe, and he has neuroinflammation, and so we got him onto a special form of magnesium, and all of a sudden he went from having no good days at school, 0, to having like 2 weeks straight of good days. And all we did was do some brain-based therapy, did some chiropractic to clear some interference up here, and it gave him a little bit of supplementation.
What type of magnesium?
It's a theanate is the main form, okay? So because we know it crosses the blood-brain barrier. Again, if it doesn't cross the blood-brain barrier, it's not going to be effective for the brain. Maybe effective for other areas. Good for muscles.
Charlie horse is real bad, and she got me on that, and they've just about disappeared.
Yeah, it's amazing. Sometimes, that could be.
I
It's
mean,
not
they
for
were
everybody.
bad.
It's not the reason, but it is.
Yeah, it could be
for a lot of
something
people.
else,
It is.
yeah.
Okay. So then glutathione we've already talked about, right? Glutathione's humongous, and then you got the polyphenols, which are also there. Okay. So let's look at this web for a minute. Okay. So what have we learned? Stress. Definitely, you're in a very stressful situation. You can get some immune activity in the brain going on, right? Hypoxia, that means you're anemic or you got poor circulation, you're overfiring sympathetic system. What happens when you're overfiring sympathetics? Sympathetics are for what? Y'all remember from school? Fight or flight, right? Fight or flight, that means an emergency. So if you're in an emergency setting, you're not worried about getting blood flow to your brain. You're not worried about getting blood flow to your gut. You're worried about getting blood flow to these muscles so I can fight or get out of here, right? So if you're in that mode all the time, you're shifting blood away from the brain and essential and vital organs, okay? Dietary proteins, this is where our gluten and dairy comes in. Dysglycemia, huge, okay? A lot of people that have trouble sleeping, the reason, especially staying asleep, is because they have nocturnal hypoglycemia. You know what that means? Well, maybe they're into that moderate stage of brain inflammation, and now they don't really have a lot of appetite. They don't really want to eat, and they don't really feel good. And maybe they got bad gut problems, so they don't eat very much. They don't have very good glycogen stores, and so in the middle of the night, the brain's going, hey, we need some glucose. And they're like, well, we don't have any more glycogen stores. And the brain said, I can fix that. I'll kick in adrenaline, and I'll get some, but guess what you're going to do when adrenaline kicks in? Wake up. So a lot of people wake up because of their blood sugar being unstable. Big deal, okay? Autoimmunity, we went through blood-brain barrier. Intestinal permeability, what does that mean? You commonly hear it described as leaky gut. Yeah. That means hyperpermeability. That means those, again, that screen in the gut's supposed to be a tight junction. It's supposed to be a real small opening to let nutrients through. And in intestinal permeability, it's opened up. And now we're letting things through that are not supposed to get through, like proteins, that now in your immune system, in your bloodstream, your immune system is attacking. It could also be an infection. It could be a lot of other things getting into the blood that's not supposed to be there. And whenever that happens, guess what's going to happen, Mr. Mark? Your immune system that God gave you is then going to say, hey, you're not supposed to be here. We're going to attack you and get rid of you. Okay? I had a guy...
What kind of infection are you talking about there?
Well, it could be a lot of things, okay? We were talking about bladder infections. Those are common. But anything that basically activates the immune system, or if you've got a leaky gut, gets into the bloodstream, then goes to other tissues, and then it can even, if the blood-brain barrier is breached, get into the brain. And if it gets into the brain, it's a bad deal. Most common thing that you might think of with that, Lyme disease. You know what I'm saying? That can be a big deal. You got something called PANS or PANDAS. Anybody heard of that before? That's where kids are cruising along really good in life, and all of a sudden they get a strep infection, and bam, they're done. Their brain's inflamed, and they're now on the autistic spectrum. You know, and what happens is they already have a blood-brain barrier breached. They already have neuroinflammation, and that streptococcus gets across the brain. It doesn't have to be streptococcus; it could be just about any kind of infection. So, yeah, most common places for adults, chronic infections, mouth, gut, sinuses, urinary tract. Those are the kind of places where you can get them, you know what I'm saying? And it doesn't matter what kind it is, really. Because it's all about the immune activity. It's more the the system getting activated that causes the problem. Systemic inflammation, that's from those autoimmunities and other places and things like that. So how do you find out, how do I as a doctor and as a clinician, how do I start evaluating where's this patient at? And you do the same thing. We say one starts with a good exam. Okay, so in the exam, what you want to know is, hey, do they have brain issues? Is it localized to just one area, or is it global? Like the one soldier that I saw yesterday, one of his head traumas that was the worst, an IED exploded close to the vehicle he was in as a medic. He's working on somebody, so he's not strapped in. He's thrown, not only does he get the impact from the explosion, but then it hits his head on the inside of the truck, right? So guess where he's messed up? Mostly over here. The other person, same thing. She has she's had 2 frontal lobe surgeries on her right frontal lobe. Well, guess what's messed up? You kind of figure out. Sometimes it's more localized, and when it becomes global, then you're thinking about other things like autoimmunity, like some type of leaky brain-based blood-brain barrier, maybe an infection. You know, stroke's going to be more localized, right? You can get degenerative autoimmune problems, and then you get hard neuroscience. So what's the difference between what I do and what the medical neurologist does? So medical neurologists, I always say, treat STDs. And you're like, what? Strokes, tumors, and diseases. That's what they treat. So, and that means they have hard lesions. What's a hard lesion? That means that there's been damage to tissue and it's gone. So you can even see it on an MRI. You take an MRI and they said, yeah, is that a stroke right here? Or, yeah, man, there's all kind of inflammation in that area from that closed head injury, and we've got tissue damage that are there. And because of that, you might have some posture changes and muscle tone changes. Your speech might change. All kind of different things can happen. It's a hard lesion. But what happens in these most of the time is what's called a soft lesion. And what that means is you take an MRI and everything looks normal, but it doesn't work normal. That's the difference, okay? You say, okay, all right. So we got to do everything we can to start to try to figure out where it's at and what can we do now to begin to improve its function. Yeah, does that make sense? Okay, improve its function. It may be a process. It may be a process of weeks. It may be a process of months. It may be a process of years. And again, depending on how severe it was and how many different things, other factors were involved. Okay, so those are kind of things that we start looking at. Now, in addition to that, hey, there we go. All right, we're going to probably do some blood tests, or at least look at some blood, and this is kind of where we start, and then we go further if we need to, okay? So we're looking at things like inflammatory markers, blood sugar problems, clotting issues, infection issues, blood-brain barrier breaches, homocysteines, a really big deal that most medics don't look at. Then we might do some other barrier permeability tests if need to be, and so forth, okay? But lab tests are important, all right? So this is where I want to get to, and then we're going to answer some questions in just a minute. So for what we do, the complete neurologic exam, okay, x-rays if necessary, and that's always a big deal because the brain needs two things. It needs fuel and it needs stimulation. And then it needs all of that to happen in a non-inflammatory environment, okay? So where do you get stimulation from? Well, you get it from everywhere, but the biggest place you get it from is your spine, and out of all the spine, the biggest place you get it is the upper neck. So we usually look at that area, and if there's a problem there, that's a big thing we can do to restore brain function, is to get that working better. Brain span, this includes the brain span test. Some of you have done this already. The brain span test is a finger prick, and it's a cell biopsy. It's where we look at the cell, we send it off to the lab and look at it under a microscope, and they determine is there inflammatory issues with the cell, is there omega-3 deficiencies, is there blood sugar effects on the cell, and then we do a cognitive online test to see where your brain's at as far as what's your processing speed, how's your memory, how's your focus and concentration, and how's your flexibility. How's your cognitive flexibility? How's your brain, is it flexible? Is it able to change, go from one thing to another? So it's a really great test. And then with this, we make some supplementation recommendations and dietary changes based on what we find from the brain span alone. All of this is included here tonight. If you sign up tonight, $165 is normally a $370 deal. That includes all of these things here that we talked about, and it includes 2 days in our office. So there's the initial evaluation day, and then there's the report day. So once we get all of our information back, then we sit down and go over with you and tell you, hey, here's where we are. One other thing that I'm going to do for each of you that want to is there's a brain localization form, which actually you're going to get one of these tonight, and you'll be able to do it already, fill it out. But this tells us kind of, hey, where areas of the brain might not be working as good as we'd like. Okay? So we'll talk a little bit more about that in just a second, all right? But if you want to tonight, if you want me to find out where you are, that's a great deal to get going on that, okay? And then I've got another special offer for y'all in just a minute, but I want to say thank you for joining us on Facebook. I hope this has helped you. If you do want to take advantage of this, you can contact our office and make an appointment. I look forward to seeing you. God bless.